Since the Condemn coalition government came to power in 2010, our health service has faced its most sustained attack since its creation in 1948, and this continues apace under the current Tory government. Soon, very soon, we will all be left with a stark choice. Go along to a Skid Row NHS, where you might be dead by the time you're seen, or take out private health insurance. Jeremy Hunt is not responsible for your NHS. Your NHS is being deliberately run into the ground by a chap called Simon Stevens. Before he got the job running NHS England, Simon Stevens was president of global health at the biggest private health firm in America, United Health. And before that, he was an advisor to Tony Blair. I believe that the NHS is by far the finest creation of any nation. It embodies perfectly the kind of society in which I want to live, and perhaps more importantly, I want my kids to grow up in. It is paid for by everyone, for everyone. Everyone gets the help they need, when they need it, whoever they are. We must demand that the NHS must be returned to its original principles. Number one, it must be publicly provided by directly employed staff. Calling for the NHS to be publicly run is simply not good enough. For example, in most areas, dustbin collection is run by a local authority, but the service is provided by a private company. Publicly run is not good enough. It must be publicly provided. Number two, it must be paid for by general taxation. This is the fairest and most cost-effective way of funding a health service. Number three, it must be publicly accountable by restoring the Health Secretary's duty to provide. Amazingly, the Health Secretary is no longer legally required to provide you with an NHS thanks to the Health and Social Care Act. And number four, of course, it must be free at the point of clinical need. Because we don't want to see an A&E reception with chip and pin machines or a demand for payment before a doctor is allowed to save your life. Your NHS used to be the envy of the entire world. And those thieving Tory swines are trying their hardest to take it from you. The founder of the NHS, Aneurin Bevan, said that no society can legitimately call itself civilised if a sick person is denied medical aid because of a lack of means. And the denial of treatment of those who can't afford it is exactly where we're heading. Don't believe the lie that we can't afford a proper NHS or that we need a special new tax to pay for it. This is all part of the ploy to push us into the arms of the private health insurance industry. There's plenty of money to run the NHS properly, it's just being spent on the wrong things. For example, since the 2012 Act opened up every part of the NHS to the private sector, the administration alone of this marketplace is costing upwards of £10 billion per year. Every penny of that should have gone on patient care, but instead it's going on contract lawyers and marketing experts who are being paid this money to take the most profitable parts of your NHS and hand it to corporate vultures. The only way that this can be halted is to fully nationalise our health service. We must return to a system where we only say we've crossed the finish line when the last of us does, because no one is alone and there is such a thing as society. We do not turn our backs on those facing hard times. We do not abandon them or exploit their weakness because they are us. Aneurin Bevan said that the NHS would last as long as there were folk left with the faith to fight for it. Conference, let's demonstrate that we have that faith and that we are going to fight for it by backing this proposal. We owe it to ourselves and to our kids.
Thank you, Dave.
Judy Griffiths, Coventry branch, to second the motion. And I think that the NHS represents what the Labour movement with a socialist Labour Party achieved for working people. We are currently witnessing the entire demolition of the infrastructure of our society. You look at housing, you look at education, all under attack. And this by a ruling class that's determined to remove all the services won by working people in their desire to maintain their wealth. They, of course, can access healthcare privately. So free at the point of need is not an issue for the rich. This is one issue that binds all working people together. From the day we're born till the day we die, We need the health service. The government is seeking 22 billion in efficiency savings by 2020. The former boss, David Nicholson of the NHS, said no healthcare system in the world has delivered on this scale. So despite a nominal increase in cash from the government, this represents the largest sustained fall in NHS spending as a share of GDP since 1951. The 2020 expected shortfall represents enough finance for 100 hospitals. The crisis can't be hidden and has been well reported over the winter period, with deaths and enormous waiting times directly as a result of underfunding. Health managers now in 44 areas of England have been ordered to draw up sustainability and transformation plans, known as STPs, setting out how they will reduce costs, change services and supposedly improve care in the wake of 2.45 billion deficit. The STP plans are complicated. They're full of jargon and misleading figures, but hidden in them are plans to cut hospital beds, close A&Es, and this is being planned secretly in the background. In summary, hospital services, GP services will be reduced and A&Es will become remote and hospitals will restrict surgery while entreating us to live healthier. In Shropshire, Redditch and Nuneaton in the Midlands, we've already witnessed the impact of STPs on local hospitals. People are dying due to poor care and waiting times, while 600 health quango chiefs sit on six-figure salaries amid the NHS crisis. But the campaigns locally are growing, and we need to build on these and mould them together across the country. We cannot leave health workers alone to fight this battle. We need to link the users, the workers in the health service, to fight a battle that we can win and at the same time get rid of Theresa May. A motion of support was passed at the Retired Members' Conference in January, calling for support for the demonstration that took place on the 4th of March in London. As a result of that, we were able to build the campaign within the union, and it was an excellent turnout on that demonstration in London from the CWU. I was very proud to be there, and Dave Ward spoke at that. But what was rather odd was there were some people I would have hoped to have been there, not there. Trade union leaders, for instance, of particular unions that have lots of health workers in them, and the TUC itself. And I think that that's what we need to do as a movement. We can build the campaign, mould it together locally and nationally, and get the TUC on board, because had they been there, that demonstration could have been 10 times bigger. We need to take this fight and pull together, mobilise through the TUC, and with Corbyn, get him elected to stop the rot. University Hospital, Coventry University Hospital alone, the car park makes millions and millions of pounds for a multinational company. You drive in, you're going to see somebody who's seriously ill, you drive in because you're going to check whether you've got cancer, and you come out with a £10 bill for parking. And that's not going into the health service, that's going into the hands of the rich. Yes, let's get the campaign on the road, fully back this motion, get Corbyn elected, and let's stop the rot. Thank you.
Thank you, Judy.
Mark Elwyn, West Yorkshire branch, rising to support the motion, and I would hope the motion is carried unanimously as the previous ones have been. But what I would ask conference is, whilst it's quite correctly said, point the finger at the Tories who are dismantling the NHS as we live and breathe, we shouldn't be complacent and think that's the only place to point the fingers at. Cuts are being made to the NHS, as I would describe as under the radar. A vital service known as the FNP, the Family Nurse Partnership, which works with young parents, teenage parents, advising them how to bring up their child, break the cycle of teenage pregnancy, and in the long term saves the NHS and society millions of pounds, because those young people then grow up to get jobs and have the best start in life they can ever have. Cuts to that service, which are an NHS service but funded usually by local councils, are being cut by the local councils. The one in Leeds was cut by the Labour Council last year. Barnsley has been cut. And if you look at the cuts that have been made to that service, it's depressing and shameful to say that most of them have been made by Labour councils. And because it's a council cut, it doesn't show as an NHS cut, although it's provided by the NHS, and it is a service working towards the health of our young people and our very young children who are growing up in the vital years that they need that support. So I would ask you to support this motion, but please don't be complacent and think it's only the Tories that want to make cuts. The cuts are being made by everywhere, by everyone. So please support. Thank you.
Thank you, Mark.
Conference, Jack England, Great Western Branch, rising to obviously support this motion. I think it's sad that this even has to be a motion, that anyone in their right mind would want to sell off a free health service for everyone. I mean, it's just it's a value, isn't it? And what annoys me, and I'm glad it's in here, is the part where it says universally, can't even say it, universally available. It's disgusting that you've got parties out there now saying that if you're foreign, emergency care isn't going to be available unless you've got a credit card. That's disgusting. If you saw someone dying in the street, you're not going to go over there and say, oh, I'll help you, but you got to pay me. It's disgusting, and that shouldn't be part of our system. It's one of the, to me, the best thing about this country is that anyone can walk in there and get treated, whether you've got a penny to your name or not. And to turn around and tell people they got to pay to get treated is disgusting. We don't want to end up in a place like America, where they have TV shows about people who just walk around with illnesses all the time and try and actually live with something which is disgusting and have like tumours hanging off of them, where they could just walk in somewhere like we've got and get it treated. You know, I saw that joke on Facebook about Breaking Bad, and if it had taken place in Britain, it would have been one episode long because they would have just gone in and got the treatment. But we don't want to be in a place where people were just tied down to money and using that as an excuse not to get fixed. And also, this motion, I mean, it's brilliantly written because it says about the rapid privatisation, which is already happening. This is a thing that the Tories and, to be honest, a lot of people haven't really known about, is that it's already happening. Contracts are being sold to Lockheed Martin, an American arms dealer, for our NHS. I mean, it's disgusting. We don't want arms dealers looking after parts of our NHS. What the hell is going on here? So I think it's about time we did something about it. I think it's good. The union's been on the right side of history already. We did the NHS march, was it last month or the month before? We had our balloons there. It's good. We're showing solidarity. Our members should be proud of what we're doing, and we need to get more of them. I see the balloons here now, looking good. But we need to get more members involved and getting this out there and letting people know, because all they're going to see is in the paper that it's all hunky-dory, and it's not. So, conference, I urge you to support this motion. Thank you.
Thank you, Jack. Call the Deputy General Secretary Postal, Terry Pullinger, on behalf of the Executive.
Good morning, Conference. Conference, I want to congratulate the branch for putting this motion in, and also the contributions that have been made, because this is one of the most important aspects of our lives, which I think this generation sometimes takes for granted. And it's people like us, fighting trade unionists, that have got to stand up and make people aware of that. To shape the future, you've got to understand your history. And that's the problem with the NHS. And some people touched on that, and I want to touch on it today, because I believe that the condition of the NHS is a reflection of the condition of society in general. I believe you can actually measure it. It's like a barometer of where we're going as a society and our humanity in this country. And there are those people out there that the profit and greed has replaced care and service. People who know the price of everything and the value of nothing. You know, before 1948, the NHS was created. Not quite 70 years yet. That is tiny in historical terms. Before 1948, this is the history bit, ordinary working class people, the mortality rate of working class people and their families was appalling. The conditions they lived in were appalling. There was no decent education. There was no decent health service. Just not much more than 70, 80 years ago, that's all. But working class people made huge sacrifices in the Second World War. They came back and they demanded a different world. and it was the closest we've got to social revolution in this country. The Beveridge Report, the election of a Labour government, the welfare state, and then the NHS was all introduced. The first time in history that ordinary, decent working people had a safety net of dignity and security to live their lives by. Our generation, this generation, has benefited from that. And it is being unravelled. And it's down to us, people like us, to get out there, get off our backsides and fight for what is important for the next generation as well. The NHS stands as a monument, in my opinion, to everything that we stand for as trade unionists and as Labour people. Equality, fairness, security in your life. People say your eyes are the windows to your soul. Well, I believe the national health is the window to look through if you want to see the state of the soul of this nation. If it's in decline, then you can bet your life that every other aspect of support or security that's there for ordinary, decent working people is also in decline. In the nearly 70 years that it's been going to National Health, it has treated and cared and saved the lives of millions of people. This nation and us owe a debt to the National Health Service and the people who work in it that we can never repay. But we can start by saying this union will continue, because we always have done. A fighting union will stand by our National Health Service, stand by the people who work with it, and support anyone and any organisation that is standing up for it. Thank you, Conference. Support.
Thank you, Terry. Well, there's been no opposition, so no right to reply. It's motion 3. All those in favour? Thank you. Any against? That's carried unanimously.